Let's get started with health promotion at work sites. We have discussed this. We just discussed this for quite a bit. It was nice hearing views from you all. We are studying this under the heading of health promotion. Studying the heading of health promotion, the unit. The this is happens to be in section B. We're talking about how health can be promoted at work sites. Why is it that they promote health at work sites? Number one, when we talk about health being promoted at work sites, like I heard it from many of you sitting over here, healthy workforce would result in more of healthy workforce would actually result in people working at their max capacity if they're motivated enough. Of course, there are many other extraneous factors that have to be kept in mind over here as well. But the more healthy your workforce is, the better they'd be able to perform for you. So workplace health promotion is the combined effort of employers, employee, and the society to improve the health and well-being of people at work. So how does it benefit the employer? It benefits the employer because if the worker is not healthy, if your employee is not healthy, they might not be able to produce the same amount of to be able to work or perform in the same manner if they would have been healthy. Number two, the employees, their health, the society in general, you could have a healthier society. Workplace health promotion strategies also combine alleviation of health risk factors with enhancement of health strengthening factors, right? For instance, there are certain workplaces that have policies like we have many military institutions, we have law enforcement agencies, we have people who work for aviation. They have certain rules and regulations that require them to stay fit, right, and presentable. The worksite policies and programs may help employees reduce health related risk. For instance, there are organizations that have proper plans for the employees in terms of them being offered at the senior level. There are many organizations that offer memberships to gyms. There are workplaces, there are organizations that offer what do you call it, insurances or benefits through which they could go and get themselves checked from hospitals. You could have periodic checkups that you can offer to your employees, which would eventually result in an improvement in terms of their quality of life too. The worksite interventions, we could bring them under these three categories over here for now. Number one, you could have science to encourage stay use. You could give your employees health education classes. Locations in terms of, like I said, gym membership discounts, weight management counseling through the employee health benefit plans. You could offer them flu shots, you could offer them COVID shots, and these days you could have cancer screening. Now, these days, I believe in the next, inshallah, few months, there would be many organizations in even in our country, Pakistan, that would be facilitating their employees with this. Now, I know people in the UAE, their organizations have already started doing that. I mean, the government in general is, but there are organizations that are making a point that they do have their employees being regularly going through the PCR after every 14 days. It's a part of their SOP now, right? So moving on, recently I know IKEA got closed at somewhere in the UAE. Before that, it was Mark and Spencer, and their franchises got closed because a single person ended up having COVID, right? So let's talk about this under the heading of token economy. I'm assuming everyone sitting over here does have an idea about what token economy is. Token economy, remember, we had discussed this while we were doing abnormal psychology, while we were discussing schizophrenia. We'd spoken about how operant conditioning could actually be used to reinforce positive behavior, right? तो टोकन इकोनॉमी का एक सिंपल एग्जांपल, आपका, इफ there's anyone who doesn't remember टोकन इकोनॉमी, आपके पास सिंदबाद, आप जाते हो, बच्चों को गेम्स वगैरह खेलते हैं, बच्चों को टिकट्स मिलती हैं. those tickets can later on be exchanged with something that the kids like. तो उसी तरीके से, let's just say if an organization comes up with a policy, with a plan, and according to that plan, if the workers make a point that they stay healthy and they are maintaining or following all the SOPs that are required, and they end up having fewer accidents or fewer problems, they you could actually motivate them by offering them something in return. So, token economy programs use the principles of operant conditioning to modify behavior, specifically reinforcement. Such programs are used in prisons to encourage pro social behavior and involve giving tokens to offenders if a desired behavior is performed. Like we had discussed all of this under schizophrenia, the unit schizophrenia from Abraham's psychology. The token may then be swapped for certain rewards in the hope that desired behavior is repeated. So I'm assuming everyone sitting here does remember the concept of token economy. Let's have a look at how token economy has been used again as a part of a syllabus in the study that was conducted by Fox et al. In 1987. Fox et al. Reported on the potential long-term effects of a token economy scheme, right? The potential long-term effects of a token economy scheme on safety performance in open pit mines. I'd like to assume everyone knows what open pit mines are. We when you talk about coal mines, they usually close, but when you talk about open pit mines, if you could have a look at this place is entire place is open. And on safety performance in open pit mines, the token economy was based around the idea of trading stamps that could be redeemed at various stores in the locality. Now, we're talking about a situation where the employees are being asked to ensure safety, and in return, they would be getting stamps, and these stamps can later on be redeemed at various stores that are present there in the locality. So, in other words, the employees are being told that they'd earn stamps if they work without losing their time with injuries, right? Of course, if there's an injury, the employee would lose his work time, right? And that is again directly or indirectly causing a loss for the organization, for the place that they're working for. Number two, being a member of a work group where all members had no lost time injuries. In other words, we are talking about motivating people by putting them together in a group. Now, not only does the employee have to ensure his or her own safety, but they have to ensure the safety of the people around them as well. Just in case if you're working in a group and someone from your group is not wearing a mask these days or is not wearing a helmet, if you talk about an open pit mine, that would eventually lead to a loss for you as well. Number three, not being involved in equipment damaging accidents. Of course, if there's an equipment being damaged, that is causing a loss to the organization that you're working for. Number four, making appropriate safety suggestions. Number five, unusual behavior that prevented an injury or an accident. So the employees, the people who were working at this workplace, they could earn points for all of this, right? And they could lose points because operant conditioning, remember, positive reinforcement, negative reinforcement, positive reinforcements when you reward someone, negative reinforcement when you punish someone, right? So the employees could lose their stamps if they or a member of the group were injured. Number two, for causing equipment damage or for failing to report any injury or an accident. Let's have a look at how things turned out to be. To remind you all of this is working under the concept and principles of token economy that we can link to behavioral psychology, the concept of operant conditioning. Following the implementation of the token economy, large reductions in the number of days lost from work because of the injuries were recorded. So there was actually a reduction in the number of days lost from work because of injuries. Number two, the reduction in costs far exceeded the cost of operating the token economy. Of course, if you're offering someone a program like this one, like token economy, like this token economy program, that is going to incur a lot of cost to the organization. But then again, if you compare it with the amount that the organization would have probably spent if the employees would have gotten injured, तो आपकी टोकन इकोनॉमी को रन करने की जो कॉस्ट थी वो कम थी as compared to the cost that the organization probably would have had incurred if they would have had people who had been injured, right? So the reduction in costs far exceeded the cost of operating the token economy, and the improvements were maintained over several weeks. The were maintained over several years. Sorry, right. Moving on. The tokens given to workers for period without lost time injuries or equipment damage accidents apparently benefited all parties immediately involved. Both the number of days lost from work and the number of lost time injuries declined at both mines following the introduction of the token economy. So what we're talking about is a win-win situation for all. Number one, running this entire program, this token economy program, this program that did operate on the principles of token economy, it apparently looks like it's a cost that the company has to bear, but then in the longer run it was seen that it was way less than the amount of cost that the organization would have to bear अगर वहाँ पे लोग इंजर होते. So this is, I believe, pretty understandable, pretty simple, and all of this is a part of a syllabus. You can get a question on this. You can get a 2 mark question on this, a 4 mark question on this, a 6 mark question on this. If you talk about paper three, if you talk about paper four, you could get a question from section A, or you could get a question from section B that would ask you to design a study related to this. And of course, for section C as well, where you'd get a statement and you'd be asked to write down the extent to which you support or you agree to that statement. This is pretty much it for today. And if anyone has any questions, please let me know.
No questions.
No, sir.
So if there's no question at all, that's pretty much it. Take good care of yourselves. Stay happy, healthy, safe, and protected. Stay humble, spread positivity, spread smiles, and Allah Hafiz.
Allah Hafiz.
Allah Hafiz.